St. Luke's Medical Center Films presents IPSG and You, a handy guide to patient safety. At Hospital X, the safety of their patients is the least of their priority. And that is a scary thing. But here at St. Luke's Medical Center, we value the safety of our patients. We are JCI accredited in that we follow the IPSG, or International Patient Safety Goals. What are these goals, you ask? Stay tuned in this video to learn more about them. But first, let's watch a scene from Hospital X. Uh-oh, and this brings us to goal number 1, identify patients correctly. Now let's watch the proper way of doing patient identification.
Good morning, sir. I'm Jem. I will be your nurse for today and I will now give your medications. For your safety, could you please state your name and date of birth as you check your ID band?
Jolo Morales, August 10, 1991.
That was perfect.
Thanks!
Who are you talking to?
No one, sir. 2 patient identifiers should also be considered before giving blood products, before taking blood or specimens, and before treatments and procedures.
What's the matter, ma'am? Are you in pain?
No, what do you think? Oh God, it hurts.
Hello, Doc. This is Nurse Adine. It's about your patient from room 155. She's complaining of pain. Do you want to prescribe any stronger meds like tramadol maybe? Okay.
Goal number 2, improve effective communication. First, the complete telephone order should be written down by the receiver.
Write down!
It is then read back by the receiver.
Read back!
Okay, doctor, just to be sure, I will be giving tramadol 50 milligrams IV twice a day for pain scale greater than 4.
And finally, it is confirmed by the individual who gave the order.
Confirm!
That's correct.
Thank you, doctor.
Hello, bro. Bro, what's up?
Hey bro, I got some high alert medications here. Where do you usually put this one?
Just leave it there at the back with the IV fluids.
Goal number 3, improve the safety of hams. Ham, no not that ham, that's more like it. Hams or high alert medications are drugs that bear heightened risk of causing significant patient harm when used in error. You would not miss them with this red label with the words high alert written on all caps. Hams are stored in these cupboards, which are double locked to prevent easy access. In addition, sound-alike and look-alike drugs, examples of which can be seen here, are segregated to avoid confusion.
So you're Mr.
Malinaw. Ulit, malinaw.
And you are for...
Tonsillectomy.
Okay, sir, I'm just gonna ask you a few questions. Do you wear contact lenses, sir? Do you have dentures, sir?
Come on, do that later. I have so many surgeries to do today. Let's go.
No.
Hi Doc. How was my operation?
Hi, sir. We are pleased to inform you that we have successfully removed both of your testicles.
That didn't go well. Goal number 4, ensure correct site, correct procedure, and correct patient surgery. Prior to surgery, the patient is identified by using two patient identifiers. The surgical consent form, complete with the patient details, procedure, and diagnosis of the condition, is signed by the patient. The surgical site is verified by the patient and is marked by the surgeon. The surgical verification form is then completed to make sure everything is ready for the procedure. Before the procedure starts, the surgical team conducts a timeout to verify for the last time the correct patient, correct procedure, and the correct site.
Nurse! 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 Nurse!
Yes, sir?
Dude, I need to pee. Where have you been, bro? It's okay now. Thanks, bro. You helped a lot.
Goal number 5. Reduce the risk of healthcare-associated infections. Hand hygiene is hands down the most basic and best way of reducing the risk of healthcare-associated infection. The 5 moments of hand hygiene approach defines the key moments when healthcare workers should perform hand hygiene. 1. Before patient contact. 2. Before an aseptic task. 3. After body fluid exposure risk. 4. After patient contact. And 5. After contact with patient surroundings. PPEs or personal protective equipments are worn if and when necessary to protect ourselves and our patients. Goal number 6. Reduce the risk of patient harm resulting from falls. At St. Luke's Medical Center, a detailed fall assessment tool is used to determine patient fall risk. Patients who are high risk of falls are those who have unsteady gait or uses crutches or walkers. Patients who are on medications that may cause dizziness like pain relievers, and patients on enemas and laxatives. For high-risk patients, measures are implemented such as raising of the side rails, placing of necessary items within reach of the patient, and of course, placing of a fall risk sign outside of the patient's room. To recap, here are the 6 IPSGs.